So you mentioned that these injectable medications were first used in the 1970s.
Yes.
So we've talked before about first generations versus second generations. Also, the first generations are called typical.
Yes.
And the newer drugs are called atypical.
Yes. Well, first generation, second generation, we call it. Yeah.
Yes. So the LAIs that we're talking about today, I assume that you're referring to the newer injectable.
Yeah, we had a
antipsychotics.
couple in the United States. We had a couple of the first generation injectable LAIs, Prolixin in the 70s and then Haldol in the 80s. And they work, but they have a lot of side effects. And we know that. Both the pills and the injectables of the first generation cause a lot of side effects. We know that, especially neurological side effects and movement disorders and EPS and tardive dyskinesia and so on. But now we have a new second generation antipsychotics. The pills were introduced starting in the early to mid 90s actually. And we have 11 of them on the market available in pill form, but only 4 of them have been formulated into an LAI.
Still 4 to choose from of the newer medications.
Well, they all work. They're all approved by the FDA, and it's up to the treating physicians, psychiatrists, to decide which one to use, or nurse practitioner, because sometimes patients are seen by psychiatric nurse practitioners. They can choose which one they want, maybe customize it to the patient, but they all work. They all work.
I understand one of them is given just once every 3 months.
Well, initially, the first atypical injectable was every 2 weeks, which is a hassle, every 2 weeks to get an injection. Most patients don't like taking injections. So pretty soon they became once a month. They developed, the companies developed them every month, which is much more reasonable. But in the last 3-4 years, those companies that make injectables have developed injectables that can be given not just every month, but every 6 weeks, every 2 months, and one of them every 3 months. But you have to start with once a month initially and make sure the dose is right. After 4 or 5 months, then you can switch them to the corresponding dose of the 3-month injection.
So these medications are very convenient for patients. They don't have to remember to take the oral meds.
That's a very good way of putting it from our vantage point. Convenient, absolutely. But more important than convenience is they are extremely protective of the patient for relapse. They guarantee that the brain is getting the antipsychotic that worked for them in the hospital, the first admission, that they stay well on it and don't relapse again. I mean, minimize the relapse rate. And many studies have shown that to be true. The majority of patients with schizophrenia respond to the first antipsychotic. Not all of them do. Some of them are treatment resistant. They need other drugs like clozapine, which you're familiar with.
Yes.
But those who do respond, like 2/3 of the patients roughly, respond to one of the atypicals, which are dopamine antagonists and serotonin antagonists. And once they're discharged, if they're switched to the injectable form of that same medication, they are very likely to remain well and be able to go back to school and go back to work and have a quality of life baseline, basically go back to their baseline.
That's what it's all about.
Yeah, because if they keep relapsing, which happens a lot, by the way, it leads to disability because there's massive amount of brain tissue lost in the brain with every psychotic episode.
Yeah.
And
lower prognosis with
and
every
it worsens the prognosis and the patients become disabled. That's why when you look at the patients with schizophrenia in this country, practically 90% of them are disabled. And it gives the impression that schizophrenia is a disabling disorder. But actually, if they do not relapse, if they are protected by giving them an injectable, right after the first hospitalization, which is rarely done, by the way, rarely done, but it's the best thing to do, then they will not relapse. And if they don't, and they stop the oral, they relapse and relapse again and again. And most of the patients in the country have had 5, 10, 15 episodes of psychosis, and their brain has lost almost a pint of tissue by the end of those relapses.
That's
How
amazing.
can you stay normal when you lose so much brain tissue? You cannot afford to lose that much brain tissue.
So it sounds like these LAI formulations may be more useful than the pills for the management of schizophrenia.
Absolutely, and the earlier the better.